In this video, the red laser light represents the ultrasound beam. After examining the urinary bladder, use the transducer in a sagittal position to find the urethra and follow it into the prostate. Fan the transducer to the patient's right side, then reverse directions and fan to the patient's left side. Rotate the ultrasound beam to a transverse position and fan or slide cranially to the cranial prostate. Then slide caudally till the entire prostate has been seen. Rotate the ultrasound beam back to a sagittal position. The prostate is not usually seen in male cats because of its location within the pelvic canal. In dogs, the prostate is caudal to the urinary bladder. When you finish the exam of the urinary bladder, the transducer should be in a sagittal position over the urethra. We will use the 95-pound Great Dane for the prostate. Remember to keep the organ centered on the ultrasound screen to reduce artifact. With the prostate, it is often necessary to angle the transducer caudally to look under the pelvis. Adjust depth to fill the ultrasound screen with the organ of interest. If needed, adjust transducer frequency for the current depth. Adjust gain for the best image, and adjust focal points to the bottom of the organ of interest. Remember to keep one finger of the keyboard hand on the freeze button ready to capture the best image. When you press the freeze button, practice leaving your transducer hand relaxed and in position so that when you unfreeze you will still have the same image. This will save you time and effort. When finished with the bladder, follow the urethra caudally into the prostate. Remember, you decreased gain in the area of the bladder for that exam, so now you need to return gain to the previous settings. Fan the transducer slightly to one side and then the other to find the widest point of the prostate. Note that I am angling the transducer caudally to look under the pelvic bone. The pelvis is causing the large acoustic shadow caudal to the prostate. Decrease depth to magnify the prostate. Press the freeze button. Use cinematic loop to select the best image and measure the prostate from ventral to dorsal. Label the image and save the image to the patient record or archives. The prostate is not normally seen in cats because of its location within the pelvic canal. In dogs, the normal prostate of an intact or neutered dog is small and has a smooth hyperechoic capsule. The parenchyma is homogeneous and relatively hypoechoic. The normal prostate in a ventral midline sagittal view may be round, oval, or oblong in shape. In my experience, the normal prostate of a large, neutered dog does not exceed 1.5 centimeters in width when measured from ventral to dorsal in a ventral midline sagittal view. Small dogs should be less than 1 centimeter in width. Length of the prostate can vary tremendously and is not usually measured. Two equal hemispheres of the prostate are usually seen in a ventral midline transverse view.